I was the first person to recognize the movements because I couldn't figure out what was wrong with me. I thought I had Parkinson's because I was shaking so bad and couldn't stop it. I did ask my family, did they notice anything, and they noticed the changes in my legs shaking and my hands shaking, and then, of course, my facial movements. The family will know how to been to the doctor to see what might be going on with me while I was shaking that way. They were just concerned because I couldn't get the things to stop.
Jerking hands and movements in my mouth all the time. And it pretty much has kept me in the house because I'm afraid of jerking all the time. My mother noticed the movements right away and said something to me about it. And we said something to my doctor about it at the time, and he said it's probably just a side effect of some medicine I was taking.
It was just his movements, his hands, his body movements. It wasn't normal. Me personally, I was scared of his mental state. Like, I didn't know if it was some type of trauma he'd been through, or because he was just wasn't himself. He was shaking and nervous. He was sheltered, like by himself. He didn't want nobody, like he didn't want nobody to see him. His hand, he couldn't grab stuff. I had to carry stuff for him. He wasn't talking a lot. I thought it was a stroke. His mouth was twitched up. His body would be twitching. It was really scary. We didn't really know what was going on.
My thumb and my index finger, I get to playing with them. Like I said, around large crowds, I get to rubbing my legs and stuff like that.
In the past, I had a lot of hand movements, and according to my sister, I was hopping around and fidgeting in my seat a lot. And I noticed a lot of tongue movement, and I didn't really notice the movements until I was in the hospital, and a nurse approached me and asked me how long I'd had tardive dyskinesia.
And his face and his legs would be jerking, and then other times it was like the jerking would just be real stiff, and then he would shuffle like an old man across the floor, just shuffle.
The movements of tardive dyskinesia are relentless. They're not called for by the individual, and the individual has great difficulty stopping or suppressing these movements. They tend to begin right after the patient has awakened. They last throughout the day and do not disappear again until the person is asleep at night.
Without actually moving your arm, the muscle would just jump, 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 jump. I'd be eating, and all of a sudden I'd be chewing. For some reason, I would bite my lips, or either I would bite my tongue. Those are some of the signs I experienced. So if somebody actually start experiencing stuff like that, you need to kind of take heed of it and get it checked out.